it's made a huge difference. We are a fairly early adopter of the portal, and from a standing start we now have 100% of our contracts, both low value and national contracts, going through that single point to market. So it's made a huge difference in terms of consistency of approach and actually in terms of responses back as well.
We use the portal for all our European level tenders. We advertise on that portal because we know that that will allow the adverts to go straight through to the European journal. We know that they're validated, and we know that people will see them both in Scotland and across Europe.
We are at a fairly rural area, and I think the initial benefit from using PS has allowed us to reach wide markets very quickly and very cheaply. So there's immediate saving in advertising. PCS covers all our advertising needs for contracts, whether they're sub-owed or over-owed.
I think one really positive benefit is we've started as a public sector, we've started being able to provide a single message to the supply base about the best method of trying to capture that opportunity. And a number of events and a number of supplier organisations, when we can advertise the use of the advertising portal, then it means that as a public sector we're speaking with one voice. For health, we've been able to introduce a number of suppliers who would otherwise perhaps not understand how to enter the health market, particularly health market in Scotland.
I would say that there is no downside to PCS. It benefits the suppliers, and it benefits the buyers, and it benefits the organisation.
Well, I think they should give it a try. It's certainly not a complicated thing to use. Obviously you've got to have an understanding of the public procurement advert, which is the hardest bit, but the portal itself and the portal training and help that's available makes it easy for organisations to use this. It opens up opportunities to the market that they might not otherwise hear about.
Because health has devolved within Scotland, it's about 1/10 of the spend of the UK expenditure. So we're 1/10 of the expenditure, but the feedback we get from our suppliers is we are 10 times easier to do business with. And one fundamental part of that 10 times easier to do business with is the single point of entry into our market. The more suppliers we can get into our market space, the more competitive we can be back to release funds back into patient care.
Well, the simple answer is it's a public obligation. As a publicly funded body, we have to advertise our opportunities. So there's a kind of legal obligation. This is a way of being sure that you're adhering to that legal obligation. So that's from the organisational's point of view. But from the supplier's point of view, it actually gives them a chance to find out about opportunities that they might not otherwise get to hear about. It also saves them a lot of time and effort cold calling when a contract's just been let, for example. They can see that that contract's been let, when it's likely to expire. They can diarise when to look back at the portal for that opportunity, and actually makes the whole market flow much better.